Good morning. Morning, everybody, and thank you for coming to our next installment of our rate study work group meeting. We've got lots of information to share today. Liz, if you want to go on to the next slide. So in our agenda, we're going to quickly go over just recap our key tasks and time frames. Gonna do some key updates from the prior work group meeting, and then we're going to start getting into the cost and wage survey updates. And then talk about some of the data sources. Sorry, I can't speak this morning. The BLS stats and benefits factor overview. And then lastly, we'll wrap up with next steps. Just want to go on and go to the next slide. So this is where we are in our timeline. We're in that April to June period where we've issued the survey. We've got the results back, and we are starting the analysis. We're targeting July to August will be our next big events for the rate development and approval of the rates. So the next slide, please. And so this one, we wanted to show you, there were some discussions last time that we had about the services. And Liz, you may have to step in and help me on this one, but we incorporated some of your feedback as far as where worker travel and transportation should be included and shifted some of those around a little bit. Liz, I don't know if you want to talk about that more before you all, and then I'll officially turn it over to you all to start talking about the survey updates.
Yeah, absolutely. So we've just made a couple of changes, and we really wanted to highlight the fact that we're really taking into account the feedback that you all have provided in prior meetings. So this here is just a really great example. So one thing we've done is condensed vehicle equipment costs into the other transportation costs based on some of the feedback that we heard. We'll also make sure that those vehicle costs are incorporated into both participant transport that you see here for the day services and residential. And for residential, what you'll notice is that we did go ahead and switch the transportation nomenclature to reflect participant transportation instead of direct care worker travel. Although we will be sure to incorporate all necessary transportation. It's just the nomenclature here that's really changing, but regardless, we will be incorporating all travel for this service. And then lastly, residential now has occupancy and supplies. So those X's were not there before, and now they are. So that's just a really great example of how we definitely find your feedback to be extremely valuable and important, and we take it into account every step of the way. So here are just a couple of changes that we've made. Okay. So getting into the cost and wage survey responses, I think this is probably what you've all been waiting for. So we're going to provide a high-level overview and talk about survey responses, as Pam noted. So overall, we had 188 survey submissions, which represents 64% of provider IDs. So we are very excited by this response, and we really appreciate all of the rate study work group efforts in getting the word out and encouraging your peers to complete the survey. That has been really critical in increasing that response rate. So we appreciate all of your efforts there. In addition to your efforts, we also provided technical assistance and training to support survey completion. So that was generally very successful. That technical assistance included training, office hours, an FAQ document, which was updated throughout the course of the open survey, as well as our inbox that we were responding to questions. So, going back for a second, surveys were available for about a month and they were due May 6th. So we've had about 2 weeks since then to begin processing the surveys. And just a note that we did continue to receive a number of surveys after the deadline. So we are still in the initial cleanup phase and we haven't gotten into the bulk of the analysis yet. The initial cleanup phase includes very detailed survey review, asking questions to providers when necessary, things along those lines, as well as compiling the surveys together so that we can analyze them as a whole. So this means that all the numbers that you see today are tentative and subject to change, even just the count of provider IDs. Those things can change as well. And really today we're going to be focused on demographics. And as we continue to meet, we will get into the bulk of the analysis. So here we show the number of provider submissions by waiver. As I mentioned, we are very excited by this response as it's higher than what we've seen in the past, and it's higher than what's typically considered an acceptable response rate, and it's well in line with what we've seen CMS approve for rates. So again, just want to reiterate that we really appreciate you all in helping support these efforts and helping get us to this number of submissions. We also looked at surveys by each service within each waiver, and those results were generally pretty representative of expectations. We have those details in the appendix for those interested, but we're not going to spend a ton of time on that today, but that will be posted if you are interested. Here are some more high-level demographics looking at employee size and use of funding. The results are generally as expected, and they provide some good background. They also confirm that we have a mix of provider types within our survey pool, and that's really helpful to make sure that our rate results are representative of multiple types of employers. So here on slide 9, we're showing the top 10 services aggregated across all waivers by number of surveys. So we just wanted to ask the group and kind of open it up for a little bit of discussion. Take a second to look at this and think about whether there are any responses here that are surprising to you, or if these responses are pretty in line with what you anticipated. Does anyone have any thoughts?
Can I ask if these are in line with the, I guess, the allocation of these kinds of providers across services?
Liz, I can take that if you want. They were, Amy, for the most part.
Okay, awesome. That's
Yeah,
really good. I'm glad to hear that.
Yeah, it looks, the numbers get, you can't do a true like apples to apples comparison because you have, some providers that may do an array of multiple services.
Yeah.
But yeah, we were very pleased with the representation that we got, not only across the provider types, but of the different types of the services too.
And I just, speaking from personal experience, and I know you'll remember this too, Pam, I think that case management providers had lots of concerns last time. And I think that they'll be like really excited to see the number of surveys represented for that service.
I will just on that note real quick, we'll say the representation of case management and the representative in particular, the increase in HCB providers this time, which and Liz will get into later. You all see kind of some more of the distribution, but have been very, very pleased with the results that we received.
Great. Anything else from the group?
This is Chris George. It just looks like a list that is almost like a priority list of like what is most important to most of our participants, as far as looking down the list: day training, support employment, residential, and so forth. So seems in line.
Great, glad it seems in line.
Hi, this is Kelly Upchurch. I don't see adult day healthcare on that list.
They make Kelly, we can go back and look. I wonder if they ended up, if it got I'm sorry, somehow bundled in. Liz, we can look to see if adult day training, if the adult day health got pulled in there maybe. But we did have Kelly, there was we had a good amount of adult day health responses. I think it may just be when we bucketed them, we may have, it just may be, or they got bucketed in the day train, one of those two, instead of it getting delineated on the slide.
Thanks, Pam.
Mhm.
Yeah, we can definitely take a more detailed look at that as well.
Kelly, I just didn't even, it just in my head, I think it, and so I just didn't even pick up that it wasn't on the slide, but we did. We'll go back and verify that, but there was a good representation of adult days that responded.
Right.
Hey Pam, it's Amy. Did you get technology assisted residential responses? Did you get any?
Not many. I think that might be on our next slide, which is the bottom 10 services. So we can take a
Well,
look.
It's a very underutilized.
Yeah.
I think we maybe only have 1 or 2 people that are using it right now. So
Yeah, I just didn't know if you got any of those responses. I was just curious.
So to answer that question, we did get one. This next slide shows our bottom 10 services across all waivers. One really key point here is that even if there's not necessarily as much representation, just especially for services here that are underutilized, we can rely on either external sources or other results from other services. That's very, very common, because there might just be services that not a ton of providers provide, and that's super common. So we are definitely able to rely on results from other services and or external sources. But we just wanted to make sure that this is something that these services are also kind of in line with what you expected.
Yeah, and I'll just remind the group that what we're listing here, the top 10 and bottom 10, there's a whole group of waiver services that fall in between here that aren't represented by these 2 slides. This is just the number of providers who responded that they provide these services.
thank you for that point, Jay, too. That's an important point.
Yeah, that is an important point. And I'll also reiterate that in the appendix, which we can go to at the end, unless anybody wants to see it. We do have every service and the number of surveys that cover that service by waiver. So any other thoughts or surprises here? Okay, hearing none, I will continue on. And I am seeing a question in the chat about whether this information will be emailed. We have been posting, or Kelly has kindly been posting the slides publicly on the DMS page. So I believe that they will be posted, these slides will be posted as well early this week. along with a recording of this presentation. Okay, so looking at some geographic distributions, overall, we see a pretty even distribution of urban, rural, suburban providers. And generally, agencies serve a mixture of urban and rural counties. So for most providers, they are not solely dedicated to just urban or just rural counties. And
Can I ask a question?
of course,
Just for comparison's sake, as far as participants go, how does that compare in terms of participants living in urban, suburban, and rural areas?
that's a great question. I don't know the answer to that off the top of my head, so we can definitely look into that and get back to you. And actually, I'm going to jump ahead 2 slides where we have this lovely map. And even though I can't necessarily answer that question directly about participants, the survey response patterns definitely do follow the larger like population distribution.
Mm-hmm.
And so that to us was really promising. So you can see here on this map that the darker the blue, the higher number of providers indicated that they offer services in that county. And so this really does follow the population distribution across the state. And we were really pleased to see that.
Thank you.
Mm-hmm.
Question. I think the way that the survey worded the question was, please list the counties in which you actually provided services, not the counties in which you're licensed to provide services. So I think to me, the responses would indicate where the participants live as well, because they're actually providing a service in that county. With the exception of outliers for facility-based services like adult day health, adult day training, et cetera. But for the residential, the home-based services, I think that would be pretty indicative of where they live.
Yeah, that's a great point. I think it's just dependent on the type of service, but I completely agree with what you're saying, Amy. And one thing that's just important to note here is that that this is just very representative, and what that means is this full geographic coverage helps us account for if there are any regionalized differences in cost that may or may not exist. That means that when we develop rates, they will be able to take into account those differences and cover the necessities across the state.
Hey, Pam, I know that because you worked, obviously you've worked on this for quite a long time, just reviewing the geographic distribution of the services. Have you noticed any significant changes from the first rate study to now, or do you have any concerns about the geographic distribution?
We have so there is a better response this time as far as there were more coverage. So for example, last time there were some counties where we only had one respondent. This one, I believe, Liz, and I know this is covered at some point in the day, that we had the smallest number of respondents from any particular county, I believe, was 5. I feel like we have a much better coverage of all of the counties this time. So, and, we expected that where you see the darker, where we had the larger, that, we expected it's where we have more, concentration of those providers. It's kind of a typical, it was what we expected. The lower ones are kind of what we expected. And it's it's more of our outlying counties or where we have fewer participants. So, and we do have that. I have actually one of my monthly, the metrics that I monitor. I have access to the participants, who lives in which county and who is on what waiver. So, we have access to that data to look at it in a little more detail. But I was happier this time with the distribution of providers. I think it's better represented. Even than it was last time, even though last time we still had every county covered. This time we have at least 5 in even the lower responding areas.
Yeah, and I'll just add, Pam, since we skipped to the prior slide, the lowest number of providers, like you said, was 5 that served a specific county, and the highest number was 55. So we were definitely very pleased with that. That was a little bit higher than last time, like Pam said. So that's what we have to share right now on the survey. We definitely wanted to reiterate that we're very excited about these responses. We feel that they're very representative of the participants, of the providers, and we feel like the response was very robust. And so more to come on this as we finalize our cleanup and really deep dive into the data analysis, which we're going to turn our attention to this week. And we'll continue to talk about survey results in future meetings, especially as we continue to get our questions answered from providers.
One last question, just looking at distribution and just kind of how where services are provided and so forth. As an agency, we provide primarily behavioral services. We have a difficult time oftentimes in rural areas getting clinicians to travel, even though there are people who live there. Will there be a distribution about which services are actually being provided in each counties? Because I think it may show that some of those underutilized, that they often may have, some day training, residential, but they're not necessarily able to access support services.
We can definitely look into that. I think that the way that the survey is written, we did not necessarily request folks to designate which service is provided in which county, but we can review the data that we do have and see what information we can get for you all to answer those questions. And I think I may have muted you by accident. So if I did that, feel free to unmute and let me know if there are additional questions.
No, I think I'm good. I was just obviously, as gas goes up and travel becomes more difficult, most of, our clinicians travel up to 2 hours in one direction, as far as being able to provide services and so forth. So I was just interested, as we've talked about, looking at those costs. Obviously, that's a very fluid cost right now that could limit the ability of particular services in less populated areas. So some of those services may need to be incentivized.
Yep, that makes sense, and that's something we can take back and talk about with DMS in terms of availability of services and making sure that accessibility is covered, and kind of report back in terms of how that plays into the rate study.
And I'll just share that, it's an important issue for DMS as a whole to ensure that there's adequacy of services across the state. It's not necessarily integral to developing a rate study, although it is important that we account for all the costs that are associated with delivering services. So it's something that DMS and as we have the data, we'll share it with DMS to look at. I almost positive that we don't have the data in the rate study though, on which services each individual has, and I know we don't have individuals' care plans to identify if there are services that they need that aren't available within their regions. That might be something to look at in the future though.
Thanks, Jay. So, wages. I know this is a big conversation, so everybody's very excited for it. You may remember that hourly wages for direct care workers and supervisors serve as the baseline for the independent rate model buildup. And for these wages, DMS is considering two sources of data: the provider cost and wage survey and data from the Bureau of Labor Statistics, or BLS. And both of these sources serve as really good and reasonable estimates of cost and have been approved by CMS as wage data sources. There are definitely benefits and challenges with either choice, but we wanted to talk about BLS today while we are still analyzing the wages from the survey, so that you all have kind of a baseline when we do analyze the wages from the survey. So thinking about some of the advantages and disadvantages of each data source, starting with BLS. BLS really uses data that is standardized and objective. It's really considered a gold standard because it's consistent, it's accurate, it's frequently updated. That standardized methodology is really key here. And the methodology used for data collection is consistent across all services, really across the country. And BLS is reflective across the general population. So it's able to serve as that larger benchmark. We're also able to look across the state as well as compare to national benchmarks. But that being said, there are a couple of disadvantages. So there is not always a one-to-one match with the data to every Medicaid home and community-based service. And we will talk about that in the next couple of slides. And then also, because it takes time to develop that standard and consistent analysis, there is a lag in the updated data. So to address this, we can of course apply inflation factors to make it current, but the data does come from a prior time period and is not necessarily going to be reflective of the current time period due to that lag. On the provider survey data, that is also really, really awesome data. It captures the entirety of the wage pool with separate overtime and supplemental payments, which is something that you all have shared has been particularly important recently. And of course, the data is specific to the Kentucky Medicaid Home and Community-Based Service Program. So it's very specific to the state program and population that we are setting rates for. And it captures as close to real-time data as possible. We asked for the first quarter of 2022, which is the most recently ended quarter. So we're really capturing very current data here. At the same time though, there is less standardization and reliability across how providers report. So we have already seen some variation in terms of how providers are reporting the same information. And then of course, we do recognize that existing rates impact current wages. And so that is what gets reported on the survey. And so it could potentially become a quote unquote circular reference. So regardless of which source is used, both are very well accepted and would be really great estimates of cost to use as a baseline for our rates. So BLS has Kentucky specific wage data across hundreds of job types. And it's very typical to go through a matching exercise to make sure that we're getting as close to apples as possible when we choose those job types, especially based on the qualifications of staff needed and the nature of the work. This really helps us to measure external proxies for what is competitive. And what we share on the following slides are recommendations for choosing those job types. And we suggest occupations that either we've used in other rate studies or occupations that CMS has approved in the past. And for this exercise, DMS has really already selected BLS occupations that have high alignment with the provider types involved in the delivery of home and community-based services. And what we need your help on is provider types that don't align directly. So we're going to spend some time today discussing those provider types, and we are requesting some feedback as to what you all think would be the most appropriate job type for comparison purposes. So, starting with behavioral support specialist. So the job.
Can I ask a question before we move on?
Sure.
This is Jay with Neuro Restorative. On your BLS, on those wages, they typically do a range, and like 25% of the market, 50, 7,500, whatever. Are we looking at a specific range or an average when you go to look at those rates determined by the Bureau of Labor Statistics?
Yeah, that's a great question. I think that is still something that is being decided, and particularly once we're able to see how those numbers align with the cost and wage survey results, so that we can make sure that we're appropriately accounting for any results in the survey. But 50th percentile is a good place to start and determine if things need to be adjusted from there.
Yeah, Liz, this is Jeff Moore with Guidehouse. I know based on kind of some more recent experience in working with other states, depending on the occupation, we've typically been landing on either the 50th or sometimes the 75th percentile. And it depends on, we do compare what the BLS is showing compared to what the survey is showing, and then also kind of based on inflation and adjustments. But we do look at the range. Typically, we're never going lower than the 50th percentile though, so.
Thank you.
Hey, this is Amy, and I have a couple questions. Number one, what is the age of the current BLS data that we have access to? When was that, what year or time span do those wages represent? And number two, can we please also incorporate information from the MIT living wage calculator into this analysis? Because at the end of the day, it's important that waiver providers be able to pay their employees a living wage to be competitive in any sort of marketplace. And, the MIT living wage calculator, which includes, costs of food, costs of health insurance, all that stuff as it relates to employees, really, provides an accurate picture of how much money it takes to live in Kentucky.
Yeah, so that first question on what time period the data comes from. The most recent data that we have access to is from May 2021, so it's about a year old, and that came out, I want to say, in the last 2 to 3 weeks. So that's the most recently available data on BLS.
So you'd have to apply significant inflation to that. Because, you know,
Correct. Yeah,
inflation.
correct. Yeah.
Okay.
And yeah, as I mentioned, we apply inflation factors to that. We, you know, by the time the rate study is complete, we may provide inflation factors to other cost metrics that are going into the models. So, you know, want to make sure that the rate models reflect kind of what the anticipated costs are at the time of implementation versus when the costs were measured. So.
When you talk of applying inflation measures, what numbers are you using? Are you using the consumer price index? What other things are you looking at?
Liz, I don't have them offhand. There are some standard ones we use for these rate studies, CPI. I think there's another one as well, but we can share those offline unless you have them handy, Liz.
Yeah, the consumer price index is the most typical, but we would be happy to share them later.
And again, I just would love if we can consider at least have a conversation about the MIT living wage data, because again, the goal here is to pay a living wage to employees.
Yeah, that's, oh, go ahead, Jay.
I was just going to say it's something that can be looked at. One of the things, and there's some commonality, so we have to make sure that we control for it. In the MIT wage calculator, or at least the estimates that they provide, include some of the same factors that we're looking at as well, insurance costs and retirement and everything. So we just have to see if there are pieces of it that we can pull out that are representative that aren't, I'm going to call it overcounted or overrepresented in the data that we've already collected and are collecting.
Okay. So, looking into which BLS occupations might be most applicable, we wanted to, like I said, open this up for conversation. What we have listed here is job type on the left. Job type represents the job title that was available in the cost and wage survey, so that way we can align the survey results with the BLS occupations. And then, of course, the second two columns are what is coming directly from BLS. And there are two options here in this example. As we continue through, there might be 3 options or 4 options for discussion. And then we have example services where this job type might apply to help you think about which BLS occupation might be most appropriate. So we'd love to open this up for conversation, and really the discussion is which BLS occupation is most applicable to this job type.
All right, I'll field this one as a licensed behavior analyst and board certified for 20 some odd years. The second one, the 193033, is the most appropriate. In getting into these job descriptions, there is along between the two disciplines, between psychologists and behavior analysts, although they are under the same umbrella, the service delivery model is different. Many, not always necessarily within this field, that people practice differently, but most psychologists see people in an office-based setting. And behavior analysts, for the most part, are doing things on site where individuals are. So the main consideration there is the amount of travel that is necessary for behavior analysts. But that second definition is the most appropriate.
Great. Thank you for that feedback. That's extremely helpful. Does anybody else have any thoughts?
And the only reason why I bring up travel is because, like, for our behavior analysts and so forth that are providing community-based services relative to our psychologists who provide office-based things, most, because of travel, most behavior analysts for a given week, if they get to 20 billable hours, that's considered to be full-time, even though the amount of travel, other non-billable stuff and so forth is there. Psychologists have the ability to see people back to back and usually are able to bill closer to a 32 to 40-hour work week directly working with individuals. So that factors into people's just how they perform and the amount of service they provide.
That makes sense. And in terms of that travel, we'll definitely be able to, we'll be able to incorporate that type of transportation separately in addition to the wages. That's kind of those additional add-ons that we talked about earlier, that it gets incorporated as under the umbrella of program support. Okay, great, thanks. So continuing on, looking at case manager, care coordinator, support broker, which of course falls under case management. We have 4 options here that, like I said, have been used in other rate studies and approved by CMS. So again, I will open it up for the same question.
Can I ask, in addition to, obviously we don't have I don't believe we have a case manager on this call. Can we request that case managers be able to give feedback on these things so that, folks who aren't case managers aren't speaking on behalf of case managers?
I think we have. So Amy, I think, Kelly, I believe you all still do some case management. We have some agencies that are on that are providing case management, but we can look at what areas they represent.
Yeah, I mean, I just know that the independent case managers feel very strongly and they know what they're, what it is that they do. And I just would love, I don't want to make decisions on behalf of folks if they don't make them feel like they don't have input.
Amy, this is Chris, and I totally agree with what you were saying, but in reading through these 4 definitions, it appears as though 210000, it would be most appropriate if I were, although I'm not a case manager, if I were taking a multiple choice exam, I would choose that answer as the most applicable, because I think that covers. The others get into specific as far as acute or terminal illnesses. Hopefully that's not the way that we approach working with our folks. Community organization, veteran service officer, I don't think applies in an ortho or prosthetic aid. Healthcare support workers, I don't feel would be appropriate either. So I think the longest definition is most appropriate.
This is Jane, and I think I'm like Amy. I think that we need to maybe ask someone who provides case management services. Though I do agree the first 2 I don't believe are appropriate, but between the next 2, I'm not sure.
This is Kristen Krebs, and we do primarily case management for the home and community-based waiver. I would agree with the 21,000 is the most reflective as far as case management. Although it is heavy on social workers, therapists, psychologists. We actually have nurses doing case management as well. So it doesn't really incorporate that, but I think that they are certainly a great piece to our program, being able to look at the medically at an individual and understanding that diagnosis, which is so heavy on supporting the programs and the services they get. So it is missing that component. But otherwise, I would say of these four, it is most reflective of what case management would be.
Thanks. Anybody else have any other input on what options, or at least on the surface, which one seemed to best fit case management as it's done in Kentucky waivers?
Okay. So moving on to DSP. We understand that the direct support professionals do support quite a few services. And so this one is definitely an important conversation, as they all are. So we have two options here, and I guess let's start with what you all think, and we can go from there.
This is Chris George. I would go with 31, 11, 20. To me, seems most appropriate.
Specifically under, this is Amy, specifically under that, I think the personal care aides, the 31, 11, 22, is we have to get down to the nitty gritty between those two. But also I would strongly suggest that we look at other sector wages when it comes to DSPs, because that's our main competition in the workplace. For example, Amazon, Walmart, Target, McDonald's. Let's remember, we're not just competing with other waiver organizations. We're also competing with, Starbucks, Amazon, factories, those kinds of places for this workforce. And I think it's important to understand what those wages are.
And I agree with Amy on that comment as well. Because I do know that, as an agency, we do hire nursing assistants as well. It's in today's world, it's a little nicer work environment. However, the wages are still an issue with that, but there's got to be something in between the two, because I think there'll be a huge difference when you look at BLS wages between those two categories.
Yeah. And go ahead, Jay.
Sorry, I would also agree with the 31, 11, 22 for HCB waiver for attendant care aides. Although we do still, although it's not required any longer in our waiver, we do have a nurse providing supervision, which I think is actually important. to go out into those homes and just assess the situations. So that doesn't necessarily fall under that little piece, but we do also have certified aides, which helps with the quality of aides that we're getting. But as far as what they're doing, I would say the 311122 also.
And I'll just make a comment on the labor market wages outside of healthcare. Those are things that will be looked at, and we'll have a conversation at a later work group meeting on how we consider what the prevailing wages are in those other potentially related occupations. Or not necessarily related occupations, but where we may be competing for the same labor force.
And one other thing we can add is that we can definitely in thinking about those other competing industries, sometimes those wages can be high because they have a lower benefits package. So that's just something to consider, and we'll talk about benefits towards the end of this presentation today. But we want to make sure, regardless of which wage category we end up choosing across any service, we definitely plan to build in a very robust benefits package into the rates. So that is something that we'll want to consider as a group as well.
Yeah, I just, in response to that, I just really want to be clear, like I live in Danville, Kentucky, which I would, skews more rural than urban, and Walmart is hiring the click list folks in starting at $15 an hour with a great benefits package. Amazon, the Amazon effect, we all know it. So I just want to caution us as we go through this. I think we can all look around and see what the market wages are. So I think we need to be very cognizant that if the data is indicating otherwise, because I can drive down the road and tell you what the market wages are for a lot of this workforce that we're talking about. So we we need to keep that in mind.
Yeah, and I think we're just being a little bit cautious because in some cases the wages may be even higher than what Amazon is offering, and we don't want to negatively impact or make some assumptions early on that we need to make adjustments when it may not be necessary. But that's why I mentioned it. We'll have that discussion as a work group when we first figure out which categories we're using, and then to see if it's sufficient to attract the workforce that's necessary. But I don't want to discount that that's an issue that's going on not only in Kentucky but elsewhere.
Okay. Thanks for all that great feedback. Appreciate the participation here.
And Liz, do we decide on one for? I'm sorry, on the direct support professional? I heard a lot on 311120. Is that what we're leaning towards?
I guess that was mostly what I heard, but definitely if we're mishearing, please let us know from the group if you feel otherwise.
Did you say 311122?
Well, we're looking at the broader category right
Oh, the
now.
whole category.
1120, which includes 1121 and 1122.
Thanks.
Okay, let's move to the next one.
Okay. Okay. So financial manager. again, two options here, and this, of course, applies to financial management services.
Can I suggest that we just start defer to Steve Shannon on this, and he's not on this call, but as he represents the CMHCs, I think that his input would be very, very valuable on this one.
Like, we also have representations from the ads. I don't have I can't see I hid my participants list, but I don't know if we have, if they're on, or not. But they also could provide.
Pam, I do not see our ad representatives today.
Okay. And Amanda, I know you're on for Steve, so we can, certainly we can, I don't know if you're, okay, so you're taking the notes to share with Steve. So yeah, so Liz and Jay, we'll get back with you on this one when we talk, because those two groups would have the specific.
Oh, I apologize. Someone is here for Michelle for Kentucky River ad. I did not realize. Thank you, Kim, for
Kim, I don't know.
That out.
I don't know, Kim, if you feel comfortable weighing in now, or if you want us, we can take that back, and you all can, if you want to take that back to your two groups and then get back with us on this one. That's perfectly fine as well.
So Kim's got some feedback there in the chat.
Okay.
Kim, does one represent more of the work than the other? Like, if you were going to divide up their time from payroll, timekeeping, and billing and posting, which one would encompass most of the work?
Okay. Kim, if you have any other thoughts, in addition to the fact that both categories apply, definitely let us know. Feel free to either write in the chat or come off mute. And regardless, billing takes more time. Okay, so I think that's the 43, 30, 21. But we'll circle back with the other folks, like the ads and the and Steve Shannon, as well as others who may be able to provide some additional input here. So I think that's it for our discussion questions. There's also a number of occupations where the occupations from BLS align directly with the job type from the survey. And so we do include both, or we've included those here just for your review. And you can definitely feel free to review those when the slides get posted. But it's it makes a lot of sense to use these here. And again, they have been approved in other states by CMS. So we do feel confident in using these as well. And I know I just kind of clicked through those quickly, so you probably did not have time to do more than skim. So, well, like we said earlier, these will definitely be posted, and feel free to review and let us know if there are any concerns with the direct comparisons that we made. So, all right. Looking ahead to the additional rate model components, another key component of wages is the benefits package. We want to be able to incorporate benefits and assume that staff will be employed, not necessarily contracted, for these services. And the rate structure will reflect that. So that brings us to ERE, which is employee-related expense, which really represents the fringe benefits that are the costs for employees beyond salary and wages. There are 3 categories that typically fall under ERE. So there's the legally required benefits, which are the federal and state unemployment, insurance, workers' comp, etc., paid time off, and any kind of like other, which could be insurance, retirement, etc. We understand that not all providers who respond to the survey currently offer a full benefits package, but we definitely are going to use the survey to understand what is currently being offered, and what is a competitive benefits package in the market, so that that the rates are able to provide an appropriate wage. So we just wanted to share with you some of the calculations that will be used. And again, we'll go into this in more detail when we have actual data. But we will use a variety of benefits available to employees based on the survey and market data. So what we'll need here is the average cost of benefits, and we're especially going to need the take-up rate. So how many people, how many employees have the option of a particular component, and how many actually choose to use that component. And that comes into play especially for multiple kinds of insurances and things like that. And a part-time adjustment factor. So because that of course will impact the wage. So we have a couple of example calculations here, looking at example for insurance as well as an example for the retirement component. And one thing to note is that legally required benefits are similar, but the take-up rate doesn't go into that component since they must be offered. And this is just sample data. It's not what will be used necessarily at all, completely example data. But this is just an example of how we do the calculations. So it's calculated as a percentage of wages. There are the 3 components that we just talked about are basically added together to determine what the total ERE should be. So what you can see here is each component is calculated individually, like we just talked about on the last slide, as a percentage of the wages, and then they're added together per employee and taken as a percentage of the hourly wage. So the wage is then being increased in order to incorporate that competitive benefits package. And then all other components in the rate model are incorporated on top of that ERE adjusted wage. So the wages that are adjusted with benefits are that becomes the baseline for the rest of the independent rate model built up. Okay. And like I said, as we continue to analyze the survey data, we will present real data in here ultimately, and we'll be going through all of that with you all as we go forward. So with that, I will turn it back over to Pam to close it out.
Thanks, Liz. So just quick, you all seen this slide several times, but again, so our target for next month, we're going to continue to discuss the model assumptions. We'll update from the previous rates, review and update them from the previous rate study, and then look at the assumptions that to include the program support cost factors, overhead, productivity, and staffing patterns. And then again, as we look into July and August, those again are tentative topics and are subject to change based on how we progress through the study. If you want to go to the next slide, please. So changes for future meetings. We heard last month that maybe this time wasn't the best for everybody. I believe that Kelly sent out we sent out some information asking if there were better times this month. Unfortunately, with having Memorial Day thrown in there, we weren't able to change this month's meeting, but we want to make sure that we do our best to accommodate calendars. So if you all can provide feedback and let us know if there's a different date or time best, and we're going to try to accommodate everyone as best we can. We also are looking at ways that we have made a commitment to being very transparent this time with the whole rate calculation process, and we are looking at, how do we leverage individuals' times wisely, but realize that as we start doing that, those are going to become more in-depth discussions and may require some additional time. So just for you all to think about that, we may need to either add more time onto existing work group meetings or have some additional meetings, and maybe even within those meetings, having some subgroups of stakeholder representatives to focus on specific services. So just things for you all to be thinking about. And again, we will share all the information like we have been doing. I know Kelly strives to get all of that posted within the same week of the meeting materials and the recordings within the same week of the meeting. Then our next slide, please. So again, just a reminder of our the 2 email addresses that you can use for questions or feedback from today's meeting, previous meetings. If you're like me, it's Monday, it's still early, it's still before noon, and I, at 2 o'clock, I think, man, I wish I asked that question. So, please reach out to us if you think of a comment later or a question that you wish that you had asked, as well as provide us feedback on meeting time and those additional meetings. Then I believe that is it for today, unless anybody else has any questions or has any other information that they would like to share. If not, we'll give you back a little bit of time. All right, well, thanks everybody for coming. And we look forward to speaking to you again soon. Have a great week.
Pam.
Bye-bye.
Bye.
Thank you.